In the throes of the industrial age, burgeoning city populations found themselves haunted by the looming specter of the mentally ill. To provide solace and care, mental asylums were established, promising a home away from home. However, the grim realities of limited funding and pressing needs transformed this noble endeavor into an isolated nightmare for countless individuals. Public attitudes and a lack of understanding only compounded the suffering. It was an era when mental asylums and hospitals emerged, driven by a prevailing belief that the insane were beyond help and deserved nothing but punishment. Get ready to be enthralled as Pastflix delves into the haunting world of mental illness treatment in the 1900s. Brace yourself for a shocking journey into the depths of this harrowing practice, where nerve connections and brain sections were severed through the eye socket, leaving lasting scars on the minds of those subjected to its horrors. This is one dark chapter in history you won't soon forget. Lobotomy, a dark chapter in the history of mental health. Before the breakthroughs in modern psychological treatment led by pioneers like Freud, Watson, Ellis, and Beck, mental afflictions were often perceived as nervous diseases. However, the treatment methods of that era were far from humane and often appalling. Mental health asylums, unfortunately, subjected patients to methods that could cause permanent damage. Among these methods, one of the most infamous was the lobotomy. The lobotomy was a harrowing procedure involving the removal of nerve connections and brain sections. Surgeons would insert a sharp point through the eye socket to reach the brain, and the results were often devastating. The phrase, "getting to the point," takes on a grim meaning here, as patients endured life-altering consequences. Surprisingly, the inventor of the lobotomy was awarded the Nobel Prize in 1949, which, sadly, contributed to the treatment's popularity. Another reason for its widespread use was the perceived ease of handling patients after the procedure. However, the reality was far from comforting. The lobotomized patients often experienced a significant decline in concentration and a complete inability to express emotions. The loss of executive function was another severe consequence, and tragically, many patients succumbed shortly after the surgery. The history of lobotomy stands as a dark chapter in the journey towards understanding and treating mental health conditions. Thankfully, advances in modern psychology have paved the way for more effective and compassionate approaches to helping those in need. Unconventional treatment methods, seizures, and comas in asylums. Believe it or not, during the notorious era of 19th and 20th century asylums, treatment methods took a shocking turn. One particularly distressing approach involved inducing comas and seizures in patients. Seizures were sometimes triggered with medications, but the more common method was the use of electrical shock. Despite its high risk and potentially damaging effects, clinicians believed that inducing seizures would cleanse the brain of afflictions. However, in reality, it often led to severe disarray within the brain, leaving patients thoroughly scrambled. Another method applied in asylums was coma therapy, predominantly in the early 20th century. Doctors purposely manipulated patients' blood sugar levels to induce a coma. An overdose of insulin could easily send a patient into a low blood sugar coma. The underlying belief was that this procedure would help clear the brain of the disease. The treatment would be repeated for 6 consecutive days, but sadly, some patients never regained consciousness after being subjected to these comas. Tragically, the brain damage caused by severe spikes in glucose was considered somewhat beneficial, as it appeared to reduce certain symptoms. Looking back, these unconventional and harmful treatment methods serve as a stark reminder of the often misguided and distressing practices that once took place in the field of mental health care. Fortunately, advancements in modern medicine and compassionate approaches have significantly improved the treatment of mental health conditions today. The dark legacy of isolation, restraint, and fever treatment. In the mental health environments of the 19th and 20th centuries, an enduring and troubling image emerges: the use of restraints in asylums. Many practitioners believed that isolating and physically tying individuals to a sitting position would bring about a sense of calm for those suffering from nervous illnesses. However, the reality was far from beneficial, as isolating and restraining patients proved to be no remedy for their mental disturbances. Society's prevailing view of the insane as outcasts led to patients being confined and restrained until their very last days. Adding to the distressing practices, some patients were subjected to chilling ice baths as a side treatment. The isolation, restraint, and ice baths exemplified the harsh and misguided approach to mental health care during that era. In the early 20th century, an Austrian physician named Julius Wagner Jaureg made a remarkable observation. He noticed that in some psychotic patients suffering from advanced syphilis, the symptoms closely resembled those of psychosis or mania. However, when these patients experienced a fever, their psychiatric symptoms miraculously vanished. Wagner Jaureg developed a treatment known as pyrotherapy, where patients were intentionally infected with malaria to induce a fever and subsequently alleviate their psychosis. This breakthrough approach earned Wagner Jaureg the Nobel Prize for Medicine in 1927, challenging the prevailing notion that insanity would lead patients to languish in asylums until death. While the fever treatment showed promise, it was not without its disturbing flaws. Around 15% of Wagner Jaureg's patients died during the course of the treatment. Furthermore, patient dignity was severely compromised, as some individuals were subjected to injections of malaria-infected blood directly into their brains. This unsettling practice exemplified the lack of ethical considerations prevalent in early 20th century mental health treatment. Looking back, these dark chapters in mental health history serve as a stark reminder of the need for compassionate and evidence-based approaches to support individuals facing mental health challenges. Modern advancements in mental health care have significantly improved, providing hope for a brighter and more empathetic future in treating those in need. Asylums, the contrast between ideal and reality. During the early 20th century, individuals grappling with mental illness often found themselves confined to asylums. Shockingly, it's estimated that approximately 70% of those admitted were involuntary patients, brought in primarily due to concerns expressed by their families. The decision to admit someone rested in the hands of the institute's doctors, and unfortunately, the purpose of these asylums had shifted. Originally established in the 19th century, they were meant to benefit society by segregating the mentally ill from the rest of the population, rather than providing proper care for the patients themselves. The sad reality that unfolded within these institutions was twofold: a lack of understanding on how to effectively treat mental illness and society's unwillingness to adequately fund these endeavors. As a result, 20th century asylums were consistently underfunded and understaffed. Patients had to endure overcrowded conditions, little privacy, and subpar hygiene. The oppressive environment was compounded by locked doors and windows, allowing only staff members to grant any form of freedom of movement. This setup left patients vulnerable to potential aggression from others or even environmental hazards like fire. Furthermore, the dietary practices in these asylums were rooted in outdated beliefs, associating overconsumption with sinful behavior. Consequently, the meals were restrictive and lacking in proper nutrition. Early reports from Australian asylums described patients bruising easily due to this nutritional deficit. One notorious example was documented by Nellie Bly, who exposed the meager rations, consisting of just a cup of tea, a piece of bread, bad butter, and 5 prunes. The stark contrast between the dream of providing care for those suffering from mental illness and the harsh reality of neglect and underfunding paints a distressing picture of the state of mental health treatment during that era. Thankfully, advancements in psychology, and the evolution of mental health care have paved the way for more compassionate and effective approaches in modern times. Nellie Bly, uncovering the dark reality of asylums. The once golden and humanitarian image of asylums and early mental hospitals was shattered by the tenacious investigative journalist Nellie Bly. A true pioneer in her field, Bly made her mark by challenging the status quo in journalism. Her boldness caught the attention of the Pittsburgh Dispatch when she reprinted a misogynistic piece and accompanied it with her own letter, leading to a job at just 21 years old. In 1887, she joined the widely circulated New York World, where her appetite for investigative reporting and passion for women's issues drove her to embark on a daring assignment. With a precursor to today's method acting, Bly went undercover, feigning insanity, to spend 10 days at the Women's Lunatic Asylum on Blackwell Island. Her daring approach allowed her to expose the horrific conditions prevailing within the asylum. Patients were subjected to commonplace ice baths, left in damp and cold clothes for hours, and forced to endure 12-hour spells of silent stillness on benches. They were treated inhumanely, with some restrained together using ropes and others treated as if they were animals, tied to carts. The food provided was hardly edible, consisting of dirty water, rotten meat, and stale bread. Bly managed to communicate with her fellow inmates, many of whom were not actually mentally ill, but rather vulnerable immigrants without a safety net or the means to communicate with the authorities. Tragically, the system designed to care for the mentally ill ended up causing psychological damage to the mentally stable. After her editor released her from the asylum, Bly published a series of articles that caused a sensation. The public outcry prompted a grand jury investigation into the asylum's conditions, leading to increased funding for mental institutes and the implementation of safeguards against abusive treatment by staff. Nellie Bly's courageous reporting helped change the public perception of mental institutions forever. This is Pastflix, and we see you next time.